The first time I was there, they gave me an x-ray and they said, you could just see the bones on the x-ray, so they said you need to go do an MRI.
When you get degeneration, it can develop instability because the disc and the joints aren't holding the bones in proper alignment. Then they can shift in relation to each other, which can pinch the nerves more. So a simple plain x-ray tells us a lot about the overall mechanics of the spine.
I think I came back a couple days later and did the MRI. Actually, I found I have a little bit of claustrophobia, so I was really worried that I was gonna have a hard time, but I found it oddly relaxing in there. It was really quiet and calm. It's a very strange experience.
An MRI is the most common test ordered all over the world. It's an amazing test, probably the greatest invention in the past 100 years. An MRI shows us soft tissue. So an MRI shows us the disc is soft tissue. It shows us the joints, because the joints have a soft tissue capsule. We can see is it overgrown and hitting a nerve. And the MRI shows us the nerves, which are soft tissue. So we can actually see the nerves going through the spinal canal, and we can see is there any pressure on the nerve? Is there anything impinging the nerve or squeezing it?
No, I've never been in jail, but I can just imagine what it feels like being inside a cage. Because you're in this little tube and you can't move. And you have to sit there for 30, 40 minutes.
If you are claustrophobic, you can get open MRIs. Image quality is not as good in general, but still reasonable enough that we can hopefully make a great diagnosis for you and kind of get you on the path to recovery.
And so while the MRI shows the soft tissue, the CT scan is best for the bones. And it shows us, is there any cracks in the bones? Do you have a stress fracture, a compression fracture, which can happen in older people? We also get it post-surgery to see, is there a solid fusion or not?
You want to get really good screens, and some are better than others. And I learned, some labs are not as good as others. And when you go to a specialist, you can go with your current films, but the truth is they're going to want to take their own, and I actually get that, because if they're a very, very fine doctor, they're going to have the latest and the greatest, and they're going to read their scans probably with a closer eye.
A bone scan is a test where they inject a marker into your blood that marks osteoblasts, which are bone-making cells. And so if you have a crack in the bone or an area of increased stress in the bones from a degenerated joint or a degenerated disc that then is loading the bones, the bone scan will light up this area with increased metabolic activity because the body is trying to heal that area. So the bone scan is a very good screening test to see if you have anything going on in any joint or bone in your body.
You need the data. You need to know what's going on with your body. You cannot ignore it. Your body will scream at you anyway.
The EMG, or nerve conduction study, is a nerve test where they put little needles in your legs or your arms to test the muscles, and it tests the electric signal across the muscles, and it tells us what's the status of the nerves. Sometimes the test can be a bit painful, but the test can be extremely helpful to determine which nerve is being affected that's going from your spine down into your leg, and it can also tell us do you have peripheral neuropathy, which is dysfunction of the nerves in your legs themselves that has nothing to do with your back.
The nerve conducting test that I had was so painful, all I could think of was I couldn't be a spy. Because they asked me the question, like, okay, we're gonna pitch you. I'll tell it all.